Are you about to have a myomectomy for uterine fibroids? Then this video is for you. I am a gynecologist and pelvic surgeon, and today we're going to talk about everything you need to know about myomectomy uncovered. So, if you've been following for some time, you probably know that I'm not a big fan of having patients go through unnecessary surgeries. And in this video, I'm going to explain why. I think it's important that every patient considering fibroid surgery really understand the risks and benefits of undergoing a procedure like this. A myomectomy is a surgery to remove fibroids from the uterus. It can be done either through an incision in the abdomen or through minimally invasive techniques like laparoscopy or hysteroscopy. There are lots of different ways to do it. But what we really want to do is remove the fibroids while preserving the uterus. So it is an alternative to a hysterectomy. Why would someone choose a myomectomy over a hysterectomy? Well, it's because there are certain situations where we're worrying that removing the entire uterus may be harmful. One is if a patient wants to preserve their fertility, and so doing a myomectomy to remove the fibroids while keeping the uterus is a good option. Also, if someone has very early stage endometriosis, we sometimes will offer myectomies as an alternative to a hysterectomy because we don't want to remove too much tissue and cause more of a problem with the endometriosis. The other reason is quality of life. Sometimes people just don't want to undergo the surgery of a hysterectomy, the recovery from that, the risk of complications, and they'd rather just deal with their fibroids. Now let's talk about the risks of a myomectomy. With any surgery, there are risks of bleeding, infection, and complications from anesthesia. In addition, with myomectomy, since we're going into the abdomen and taking out these fibroids, oftentimes they can be quite large. The risk is that we can accidentally leave some small pieces behind. And if we do, that increases the risk that new fibroids can grow back in the same area where we took out the old ones. And so this is why, as a gynecologist who offers both hysterectomy and myomectomy, I often will recommend a hysterectomy to my patients because it's a lot easier to just take the whole thing out than to go in and try to take out these fibroids and make sure we get all of them. In terms of how many fibroids you can have removed during a myomectomy, it really depends on the size of the fibroids and how big your uterus is. So it can vary from a few small fibroids to a handful of medium-sized fibroids. If you have a very large uterus, if your fibroids are very large, or if your fibroids are deep into the muscle wall of the uterus, then we may recommend a hysterectomy instead. The other thing to consider with a myomectomy is the recovery. It is usually longer than that of a hysterectomy. You'll likely need to take time off from work. You may need help at home, and it's really important that you arrange for that ahead of time. Finally, the recurrence of fibroids after a myomectomy is pretty high. Studies show that anywhere between 30 to 50% of patients will have new fibroids develop within 5 years after their myomectomy. That doesn't mean that you will, but it just means that it is something to think about. And if you do get more fibroids, then you lines have to decide at that time whether you want to get more surgery or if you want to consider other treatment options like an MRI-guided ultrasound or a hysterectomy. Overall, I hope that this was helpful for you to understand what a myomectomy is, when we use it, and the risks that are involved. If you have any questions about fibroids, please comment below and I will try to answer them. And if you'd like to learn more about fibroid treatment options, make sure you check out my last video about uterine fibroid embolization. As always, we're gonna take care of yourself because you're worth it.